Good morning and welcome to GP Podcast by Nadia. Today is Tuesday morning and again I start my work at 11, so I'm going to do a 5 minutes podcast for you guys and for my passion. So the topic that I'm going to touch upon today is again massive and of utmost importance because it is a global pandemic, and it has got, with the treatment, it has got controversies related to it, but I have a very strong mind regarding its treatment and I am very pro treatment in this condition. And I'm talking about obesity. So obesity is a global pandemic, as we know. At the moment, like diet and exercise are the first pillars. Seeing a dietitian and exercise physiologist are still the first pillars of treatment, but once the patients come to a doctor, they come while they have tried all the other avenues or are in the initial stages of the trial, but they have tried like different diets in the market, they have joined gym, they have done Pilates, they have done yoga, but they haven't achieved their desired results. So they come to the doctor for the treatment, and very fortunately we now have two kinds of treatments available. So one is oral medications and one is injectables. It's a vast topic, and I am pro both oral medications and injectables, but injectables are the best. So injectables are the best option because they have least profile of side effects and they can be used even for lifelong if you like. Yes, that's what I said. It is what I said. So we'll talk about the oral medications as well, because I've been using them with my patients as well with terrific results. But the problem is that they cannot be used for long term, and also they have got a higher side effect profile, while these injections are very, 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 very safe. And especially one of them, which is semaglutide, commonly known as Ozempic for the diabetics. It's a brand that is reserved for the diabetics in Australia by PBS. And the private branding of the same medication called Wegovy, this is one of the safest choices. And actually, it is endorsed by cardiovascular like physicians and surgeons as well, because it has got long-standing cardioprotective effects. So so these injections are very, very safe. Unlike all the controversies attached to it, very, very safe to use, very convenient to use. The only problem at the moment in Australia is they're quite expensive. So I come in because it's a long topic. As I said, there are so many things to cover in it. So because I can only make a 5 to 7 minutes podcast, so I'll just continue it in a few others, but I would just try and start. So obesity, as I said, is a global pandemic. It's linked with, like, when you are obese, you have all the higher chances of getting diabetes mellitus type 2, high cholesterol, high BP, sleep apnea, tiredness, lethargy that we spoke about yesterday, joint pains and aches, especially knee and hip and knee joints, because they are the ones that bear all your weight, and many other symptoms. So yes, when you do these injections, you have to do them with exercise and diet. You cannot just rely on the injections and say they are going to do a miraculous job for you. No, but then you have a tool. You have a tool to kickstart your weight loss journey, and then you will be more motivated to be exercising and dieting as well. Also, we should have a definitive goal weight in our mind while we start our journey on Ozempic or Wegovy or Saxenda or Mounjaro, all these injections that I talk about. Do not feel judged. Do not feel judged in using them. They are just medications there to support you. Yes, when you are obese and you'll have all these medical conditions that you will suffer from, then you have to be more apprehended about them. Not for the fact that people are going to judge you because you are using Ozempic or Wegovy or Saxenda. Also, don't expect miracles when you start them. Give them at least a month or so. The numbers will start coming down eventually. Also, not only that, but they might then after that plateau again, and then will start dropping. At least you will not be gaining it back again while you are on the injections. And again, as I said, you can go off them, you can come back on them, because they can be used even for lifelong without any safety precautions. And as I said, that Wegovy or semaglutide has got, which is also known as Ozempic. So semaglutide is the pharmaceutical name, while Ozempic and Wegovy are the brand names. And this is a weekly injection that I'm talking about that is favored the most according to its cardiovascular effects and its effects and use in diabetes as well. I think it's been a 5-minute video already. So what I'll do is I'll continue with this topic tomorrow as well. You guys have a great Tuesday.